Without saying the name, what's your favorite video game? This was when I was an anesthesia resident. A pregnant woman comes into our medium-sized community hospital in the Canadian West in the night with some abdominal pain and nausea, something minor. Her doctor determined she was not in labor, so just treated with some meds and she started feeling better. She was about to be sent home in the morning when the new obstetrician for the day noted that the patient's blood pressure had dropped. The new doctor felt the patient's uterus and it was exquisitely tender, and the patient is feeling very faint now. Now the diagnosis is likely uterine rupture, basically a hole burst in the womb, so she was rushed to the OR for an emergency C-section, and that's where I get called in to help my staff. Uterine rupture is bad enough, but when they get in there and remove the tiny preterm baby, they discover that it wasn't a uterine rupture but a placenta percreta. That's when the placenta grows through the wall of the uterus and into the surrounding organs, in her case into the bladder. We rush the patient from the small OB floor or to our biggest OR, call in more surgeons including a urologist, and me and 2 other anesthesiologists start a massive blood transfusion protocol as she's bled so much. This condition is usually able to be screened for on prenatal ultrasound, but the patient had skipped hers. If known beforehand, she likely would have been sent to Toronto for the risky and delicate surgery. If she had gone into labor to try to deliver normally, she would have very likely died. She and the baby did totally fine. A couple hours after her several-hour surgery, she was awake and chilling with her healthy baby. I had a patient with a similar ethical dilemma. Except it was the daughter that gained healthcare proxy rights. We finally got them to go DNR, and the mother actually had a very peaceful death surrounded by the loving family. But then it got weird. The next day the daughter had gone through the entire hospital chain of command complaining about why her mom died, and what really caused it, and was legitimately talking about exhuming her freshly buried mom to have a second autopsy to determine cause of death. She was elderly, frail, had numerous health problems, most recently aspiration pneumonia, and severe dementia. She got sicker and sicker and eventually stopped eating. Essentially failure to thrive due to dementia and possibly sepsis from pneumonia. Had a woman about 3 weeks postpartum come in through the ER with excessive bleeding. That's fairly unusual timing for that particular problem, normally happens a little closer to delivery. So I took her to the OR for a D&C, expecting a little retained placenta and that the bleeding would improve as soon as I got it out. Boy, was I wrong. As soon as we got in the OR she started hosing out blood. This was the fabled audible hemorrhage. Profound uterine atony. Suctioned her out real good, but it didn't really help, so I did a bimanual uterine massage. Imagine putting your hand in a boxing glove and then massaging the glove with your other hand, until they could bring me a uterine tamponade balloon. That's a big balloon you fill with saline inside the uterus to apply constant pressure. Plus all the meds we gave to make the uterus contract to hold pressure against itself. Finally got the bleeding stopped and she did okay once we gave her some more blood. Final blood loss estimate was 1,000 cubic centimeters in the ER plus another 2,000 cubic centimeters in the OR, plus whatever was at home and in the car. Had to drive herself because her boyfriend wouldn't bring her in. Best part is that pathology report never showed any retained placenta. Her uterus just tried to murder her that night. I got a thank you card from her a few weeks later with a handwritten note in it, "Thanks for saving my life, I guess, LOL." Patient with a pilonidal cyst that was bothering them for years but was never bad enough to do anything about it. For those of you who don't know what this is, it's a cyst which can be very large at the cleft of your buttocks caused by hair or hairs that burrow deep under the skin. Sure enough, I guess during pandemic sitting for longer periods of time inflamed it and it became infected. So normally if there isn't surface draining needed we refer to a surgeon for treatment, but this one peculiarly had opened on its own and was said to have been slowly draining for weeks. We've all seen dry pimple popper, so I thought I should have a closer look. To my surprise I can see a nest of hair in this dark hole opening of the cyst, and my curiosity and absolute need to remove it took hold. As disgusting as that is, you can imagine years of pus and hair under the skin festering. Nothing can prepare you for when that bundle of hair, acting like a plug, releases behind it the most foul-smelling pus explosion that, luckily, hit most of my mask, but bridge of my nose and eyebrow. I'll remember the smell forever, but more importantly remember my face shield. ER doc here, patient arrived with complaints of vaginal spotting. History revealed she had been bleeding for 2 days, not very heavy, just a little pain. Stated it started after her female partner had been a little rough during their last sexual experience. Physical exam revealed a complete tear through the posterior vaginal wall into the rectum, consistent with what we would usually see during a difficult childbirth. The situation was a bit fishy given the amount of trauma and the backstory, so I ordered the usual tests: blood count, coagulation panel, chemistries. In accordance with our protocol, she was definitely going to surgery, tacked on a urine pregnancy test, even though she denied the possibility of pregnancy given her sexual preferences. The pregnancy test came back positive. Needless to say, this opened a huge can of worms. Turns out, she had delivered a child 2 days ago in secret but didn't tell anyone. Had been hiding the child from her family/girlfriend. Child Protective Services, the police, EMS, pediatrics, ON/GYN all got involved in the matter of minutes after that revelation. They found the child in her apartment under some towels alone in her home. It was a doozy of a night. To those who are wondering, yes, she was a larger woman whose pregnancy was hidden by her size. This happened 5 years ago and I have seen the child since, doing well with her grandparents who have full guardianship. The 80-year-old who came in with a self-inflicted shotgun wound to the chest. As we are fighting to get him stabilized and the surgeons are working to plug all the holes, none of us can figure out why the guy keeps oozing blood. Then we find out that he had intentionally overdosed on blood thinners before shooting himself. We kept him alive long enough to let the family come into the OR and say goodbye. The 45-year-old who came in via private car, family drove him in, rather than an ambulance, after what was described as a head injury. We realized how bad it was when someone noticed a plastic grocery bag lying on the patient's belly. It contained the brains that the family managed to scoop up, in the hopes that we could reimplant them. The 30-something meth addict who also had a permanent catheter infusing life-saving medication directly into his chest for pulmonary hypertension. He came into the ICU with pH crisis, and then we found out why. He had been injecting meth into the catheter, creating a hole through which his life-saving medication leaked out. Medicine is a lot of things. Sometimes it's just tragic. Not a doc, but as an EMT trainee, I did my first ride along on an ambulance and we went to check out a guy who fell at a skate park. When we got there he was conscious, could walk, and talking coherently. He'd fallen and hit his head, no helmet. But we did a full inspection anyway, careful avoiding the obvious bruise forming above his eye. Not much blood, pupils were normal, didn't seem bad, probably concussion and a black eye. Well, he could have turned us down, but we talked him into coming with us to the ER just to double check everything. So we get him in the ambulance, lay him down, and it was my job to check his blood pressure. It had gone down significantly since first check. Well, it didn't take long and he seemed to be losing consciousness, getting sleepy, and then, he starts throwing up blood. That would be the things just got even worse moment. We turned on the sirens at that point, the paramedics started fluids, blood pressure kept dropping, it was no bueno. He was unconscious by the time we got to the ER. It sounded like he just barely got there in time. Head wounds bleed a lot as we found out, and not always obviously. That part we skipped, touching the bruise above his eye because it was obviously going to hurt him. Well, we shouldn't have skipped it. If we had, it would have felt super mushy, because all that bone around his eye and cheek was crushed. And all the blood. Well, it was draining down his throat and into his stomach. This will probably get lost, but surgeon here, some young guy 21Y/O came in the ER 3 a.m. with a stab wound. He waited hours before he decided to come in, laughing and joking around, brought his whole family and friends, mom, dad, brothers, and friends. Was a trauma level 1, brought him immediately to the trauma room, systolic B/P70S with HR150S. His body was trying to compensate for loss of volume. As soon as we brought him to back, he coded and he was never brought back. Last-ditch effort was made and a manual cardiac massage was attempted. They crack your chest open and manually pump your heart to restart it. The knife had nicked his abdominal aorta and it completely ruptured, liters of blood spilled into the floor. It was like a scene from a movie. Meanwhile, his friends were having a pizza party in the waiting room, laughing and having a good old time when we had to tell them he died. All hell broke loose and they stormed the ER by force. Security and police were called, punches were thrown. His brother got a glimpse of him and yelled, "You killed him." He came in walking in whistling like nothing, and you guys murdered him for his organs. Punches were thrown, people were tossed. Good times. Not a doc, but I used to work for radiology in a small hospital and was there kinda Mr. Everything we don't want to do, lifting, security, transport, babysitter, etc. A young mid-20s couple gets brought in on backboards after a car wreck. Middle of February, ICAF, and the guy rolled the car. The girl gets a bed in the ER. She's mostly fine, beat up quite a bit but still coherent and talking. A state trooper is in her room with her. The dude is complaining but overall seems fine. She's asking me to see him and I tell her that they're stabilizing him and he's not going anywhere. She says, "What does that mean?" Over and over again, and I tell her that he's in a bed on a board, so he can't move. She's freaking out. I take the guy back to radiology, he's talking and joking, things seem fine. We do the CT and his spine is broke, not just broke, severed. Guy is in for some serious surgery, rehab, might never walk again kinda stuff. The girl runs out of the room, cop chases after her, they start fighting. A little 110 pounds girl is straight up squaring up with this big ass cop. Cop ends up tasering her in the middle of the ER. Her dude is screaming because they told him about his spine, his girl is now chained to a bed. Turns out they were running drugs, high as eagle balls, flipped the car and the dude probably never walked again. I always wonder though. Patient came into hospital with cystic fibrosis with end-stage lung function, had an infection but was there to get optimized for a lung transplant. Was transferred to ICU after hemoptysis, and then in ICU had massive hemoptysis and coded. Was a fucking shit show, a major artery in his lung had eroded and he was bleeding out into his airway quickly. At any normal hospital this already is the end, fortunately he was at an academic tertiary medical center. They coded him for between 50 and 60 minutes before getting ROSC at the same time as massive infusion protocol and cannulating for ECMO. He had no chance at living without a transplant, and even though it was already a long shot, they did the lung transplant while he was on ECMO and after he had been that way for about 10 days with basically no response to stimuli. After another couple weeks with the new lungs he started to respond and was taken off ECMO. 2 months later he walked out of the hospital. Had no major deficits a year later at follow-up. In my head he's like seeing a ghost or a zombie. Not my case fortunately, as I was spared from this case by my consultants at the time. They refused to let any juniors see the patient as they felt it would be too traumatizing, and obviously we were also denied any ability to assist for the same reasons. Necrotizing fasciitis. Rare, often deadly. Frequently found in the nightmare fuel aisle of your local hospital. First OP. Debriding dead tissue constantly. The gentleman was not a small man, he had a lot of spare tissue, to put it mildly. Originally. Impression was that he caught it from a cut on his lower left leg and it appeared to be spreading, up to his groin and then to his right lower limb. Trying to get to something non-necrotizing was difficult in the first operation but deemed possible. Stopping at obvious areas as trying to preserve some function. Almost certainly a mistake. The second attempted debridement was described to me as my consultant standing thigh-deep in what was left of a man's waist and legs, with tissue sloughing off all over her legs as she debrided and bilaterally amputated this man above the knee. He didn't survive the following 24 hours. I had an elderly patient once who went into cardiac arrest and was brought back. She had an extensive workup done, but we never found a great reason for why she arrested. Then, just as she was getting better and had her breathing tube removed, she arrested again. We did CPR and were able to get a pulse back, but she remained super sick all night. We were supporting her heart with a mechanical device and she was on high doses of medications to keep her blood pressure up. We were doing everything possible but things were not looking good. We ended up calling her elderly husband and asked him to come in as we were worried she would not survive the day. Her husband told us he would be there within the hour. Well, 2 to 3 hours passed and he didn't show up. We tried calling and couldn't reach him. Then somehow someone found out that he was actually in our ER. Turns out he had left his house, fell, and broke his hip. As we hastily tried to arrange a way to get him upstairs from the ER to see his dying wife, she arrested again. We were actively doing CPR as they wheeled her husband on a stretcher in a casted leg to her bedside, at which point he called off the code. Everyone was crying. It was pretty awful. Nurse here. Midwife let a mom go through over 8 hours of the pushing stage of birth to the point the mom went into severe decompensation, blood pressure plummets, saturation drops, fetal distress, etc. In Canada, midwives practice separately from doctors and nurses. They usually just have an agreement with hospitals to use the beds, although medical care is available if the delivery becomes high risk. Doctors take over and go in for emergency C-section. Realize the arteries in the sides of the uterus are ruptured due to pulling away from the strained uterus and extensive pushing. Baby came out fine but they had to work on mom. Finally close her up only for mom's pressure to plummet again. They open her back up and realize another artery was bleeding, so they clamped her aorta until they could repair the damage. I.e., her lower body didn't receive blood flow for several minutes. They replaced her blood volume at least 3 times throughout. Finally the team stabilized her but were afraid of anything else unexpected, so they packed her but left the wound open, then sent her to ICU. I received baby in NICU. Baby was okay. Mom survived, although didn't find out much more. Surgeon, I was repairing a self-inflicted gunshot wound with unknown history. I take face trauma, so it's not an unusual call. However, I couldn't make sense of the anatomy. He had shotgunned the roof of his mouth and cornflaked his palate and maxilla, but typically you can piece it back together. I soon came to the realization that it wasn't normal anatomy. He had a giant squamous cell carcinoma tumor infiltrating and eradicating his palate and maxilla, and had blasted the tumor. Although he survived the gunshot, he would not survive this cancer. There are a few things worse than death, amongst them is uncontrolled head and neck cancer. You lose the ability to taste/eat, talk, smell, breathe through your mouth, eventual emergent airway like tracheostomy or laryngectomy, with the exception of the taste and smell of your own purulence and fetid tumor, accompanied by perineural invasion of the trigeminal nerve leading to severe pain, and eventual dementia and death. All the while you're disfigured and fear-inducing to others. He had just seeded it everywhere and removed any chance of palliative surgery and radiation. We did this man no favors by saving him. Also, get the Gardasil vaccination. Can prevent this. Intern year. This happens right at handover as I'm coming on. Patient had dysphagia from multiple intubations, inability to swallow well, weakness in the swallow muscles. Nosebleed starts. He had nosebleeds before that weren't too serious. It's still going, we are giving Afrin, vasoconstrictor in the nose to tighten the blood vessels, and holding mad pressure. Ant is like OMW and rushed over. Ant looking inside the throat, there is a clot in there. I watch as the clot falls down this man's throat. O2 sat 98% 60%, HR 140/50. I immediately know this guy is about to code. Get the card, no pulse, 9 AP pushes and like 11 or 12 rounds CPR. We are going to call time of death, but the man had a faint pulse after that last round. During the code, anesthesia intubates the patient immediately after CPR started and pulls out a bratwurst-sized clot out of the trachea. Damn, he bled way brisker than we could see. He still died that night due to shock, low BP, despite 3 pressors, blood pressure raising medications, being maxed. Honestly, it was a miracle he survived the initial illness that brought him into the hospital, but I still cried when I got home because it was a particularly difficult death for me to process.